Hello friends, today we will be talking in brief about rhinoplasty. Rhinoplasty in normal terminology is known as nose job. Basically, people are concerned regarding the shape of their nose. The nose is very broad, or it has got a small hump present on the dorsal aspect, or it is flat, and some patients they are having difficulty in breathing. So there are mainly two types of rhinoplasty. One is the function rhinoplasty, that is for the breathing problem, and other is cosmetic rhinoplasty. Today we will be talking mainly about cosmetic rhinoplasty. Uh, Considering the type of problem that patients are having, or the whatever is their major concern regarding the shape of the nose, we do perform rhinoplasties, and for different problems there are different procedures. Starting from top, this is the dorsal part of the nose, and patients are mainly having two problems. One is dorsal hump is there, that is over projection of the nose, maybe slightly oblique downwards, and other is the saddle nose, that is completely flat nose. For these two parts, we do perform surgeries in which we do dorsal augmentation of the nose, and we do the flattening of the nose. For dorsal augmentation, we can use silicone implant, we can use posterior auricular cartilage, or we can use part from the rib. The results are very good in all the three things. We preferably go for silicone implant because the results are much superior in comparison to other two, and the patient doesn't need not to undergo any separate surgery. For posterior auricular thing, we can ourselves understand, because we need to take a separate incision over here. For ribs, we take a separate incision over the chest part, and for silicone implant, we do put an implant on the dorsal aspect, and we need not to perform second surgery for it. Now coming to this part of the nose, that is the tip. Patients are somewhat mainly concerned regarding the tip part. Tip may be very flat, so we do tip plasties for that. And if we perform surgeries for shorter columella also, and columella can be elongated so that the nose automatically gets lifted. People there are only also concerned regarding the shape of their nostril part, and the nostril is very broad. For these patients, we do perform cartilage reduction, the nostril size got reduced. Patients are also concerned regarding this LR part. The LR part is very broad. This leads to very abnormal shape of the nose, and mainly the nostrils are very broad. That doesn't look nice on the face, and we do LR based reduction for this. For there are multiple procedures. We can do multiple procedures for different deformities. It can be performed simultaneously, and we normally keep the patients for 24 hours for us, and after 24 hours we discharge the patient. Patients are kept in hospital maximum for 24 hours, and after discharge the patients are sent back. They are sent on antibiotics and analgesics. The swelling over the face that comes after surgery is there for 10 to 14 days. Patients who need osteotomy, that is this part of the nose, if it becomes very broad, the patients who undergo osteotomy for that, those patients, they need to stay in the hospital for maybe about 48 hours, and the swelling part that is there, that is also more as compared to non-osteotomy cases. Patients, then the sutures are removed from the face or the other part, removed on the 10 to 14 days. The sutures that we apply on the inner side of the nose, those sutures are absorbable ones. The sutures that we perform or do for the LR based reduction part, that is the reduction of the nostril, those are non-absorbable sutures. They need to be removed after 10 to 14 days. If you have got any problem and further queries are there regarding the type of surgery that you need and that type of procedures that we can perform on you, then you need to contact on the above number. Thank you very much.